Over the last couple of years, students have really started reaching out and wanting that advanced degree because there's places that therapists can go. They can go into leadership, they can go into research, management, and they're really looking for that higher degree to kind of solidify that ability to get that degree they're looking for or get that position they're looking for.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
Who's the only local bank with a mobile mortgage app? Farmers. Download the app to contact your lender, calculate payments, securely scan and upload documents, and check the status of your loan. Fiercely local, fiercely loyal, Farmers.
Respiratory care is a specialized area of care that takes care of everybody from the newborn to the end of life, patients that are afflicted with cardiopulmonary disease. Most of our therapists work in critical care. That's the number one place for them to work, which kind of makes sense because most people have breathing problems or heart-related problems. But they also work in outpatient care centers. They work in lifelike, they work in transport, they work in rehabilitation. So it's a pretty broad picture for respiratory. A lot of our therapists that get higher level degrees end up working in research, clinical research, getting products to market. They work in product sales and education as well.
Our students are coming out with a baccalaureate degree, as well as having a lot of the certifications that they want out there in the field. So it's the basic life support, the advanced cardiac life support, the neonatal resuscitation, the pediatric advanced life support. So they come out really highly educated, and I don't want to say compared to, but there are the associate degree programs that just don't have the time to incorporate that we have with the 4 years with them.
Over the last couple of years, students have really started reaching out and wanting that advanced degree because there's places that therapists can go. They can go into leadership, they can go into research, management, and they're really looking for that higher degree to kind of solidify that ability to get that degree they're looking for or get that position they're looking for.
You'll find a respiratory therapist traditionally anywhere where you're going to find nursing as well. So you're going to see respiratory therapy not only like in the ER, in the hospital and intensive cares, but you see them in labor and delivery. You see them up in life flight. They have respiratory therapists that fly. You see them in sleep labs. You see them in pulmonary function labs. You see them in education. So you see respiratory therapists everywhere. But traditionally, as soon as someone's coming in as a trauma, a therapist is on as well.
There isn't a week go by that I don't have recruiters wanting to come. And usually this time of year, because they graduate in the spring, we have a fall start and a spring graduation. We have somebody about every Thursday that wants to come through the next couple months, and they come in and recruit them. A lot of our therapists are offered their entry-level positions, but they're actually offered incentives to come. For instance, there's hospital systems in Florida that are offering them $30,000 sign-on bonus. So there is quite a shortage, and there's a huge need. So we would love to expand the program to kind of help fill that void. But again, during COVID, things changed quite a bit, and it brought about awareness of the need for the profession. So I think you'll see a lot more people wanting to come to the program.
The word is out there a little bit more and the students hear it because traditionally what does society know? They know that there's doctors and they know that there's nurses. Sometimes they know a couple other things too, until you come in contact with someone that maybe you do have some sort of respiratory disease, and then you come in contact with a respiratory therapist. But I think the word out there right now is a little bit bigger, that we are out there and we're in need.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
Who's the only local bank with a mobile mortgage app? Farmers. Download the app to contact your lender, calculate payments, securely scan and upload documents, and check the status of your loan. Fiercely local, fiercely loyal, Farmers.